for you.
According to the Nigerian Center for Disease Control and Prevention, there has been a report since the 11th of June this year that about 1,141 suspected cholera cases has been recorded across 30 states in Nigeria. And this is also including last year's report. And you'd have noticed that around this period, we normally have outbreak of cholera. Lagos State is doing so much in that regard. But again, we need to adhere to some precautionary measures. So today on the program, Dr. Ademola Yusuf Harun, popularly known as Dr. Love, will be telling us all we need to know in terms of preventive measures, all right, and how you need to actually stay safe this period. Plus, we have a report on the importance of fruits. Medical practitioners have always advised that we stay high on vitamins this period, all right, and fruits are a good source of vitamins. All of these on this week's edition of Health Watch. My name is Nkem Kibi, and you know how much I love to do this with you every week. Let's take this short break on cholera, and then when we return, you meet our guest, Dr. Love, is standing by. All right, if you're just joining us, the program is still Health Watch, reaching you from your #1 station, NTA Lagos Channel 10. And this week our focus is on cholera. And my guest today is Dr. Love, Dr. Ademola Yusuf Harun. You're welcome to Health Watch.
Thank you very much.
I love to do this with you every week. All right, and it's good to have you again on the show after a long time. Now, talking about cholera, there's been a recent outbreak, and I've noticed that each time during the rainy seasons we have this issue of cholera, and it's a big concern because I feel like a lot was done last year and we're having this outbreak again. So I think we should just go back to what are the causes, you know, why are we still having this recurring issue all the time?
Thank you very much. This is a very important question. Firstly, the etiology or cause of cholera is by a bacteria called Vibrio cholerae. This bacteria is what causes the cholera that we see. And we also have to understand the pathogenesis and pathophysiology of this disease. Cholera usually occurs in rainy season because it's associated with water. Not only water, places where there is poor hygiene, poor sanitation, poor latrine. So people who are usually susceptible to cholera are people who don't maintain proper hygiene. Its mode of transmission, based on the causes which you asked again, is that it is fecal-oral. That is, it's usually transmitted from the feces or fecal matter into the mouth. Someone who doesn't wash his or her hand properly, or if there is food which is not properly cooked. We talked about fruits. If the fruit also is contaminated, or the food or the utensils, this particular person or group of individuals have a high rate of contacting cholera. And you also mentioned that about 30 states out of 36 in Nigeria have developed the outbreak of an outbreak of cholera. That's because during this rainy season, most latrines or places are not properly drained. So this water from the sewer gets into the streets and the roads. People are cooking near this kind of areas and they get infected with cholera. Also, many people are guilty of defecating publicly. And this is another cause or another predisposition.
That's open defecation.
Open defecation. You see it on the streets of Lagos. You see it in many places all over Nigeria. And these are high risks of cholera. We also know that a housefly can also perch on this open fecal matter, and this same housefly can perch on someone's food, thereby infecting the person with cholera. So the primary cause or etiology of cholera is by this bacteria called Vibrio cholerae. And we now talk of the incubation period. It has a very short incubation period from the time of onset to the time of manifestation of the first symptom. It could be as quick or early as 2 hours. That means somebody might just be infected with this cholera, and within just 2 hours, the person starts to develop the symptoms of cholera. So between 2 hours to 5 days, the person can develop symptoms of cholera, and it can be fatal, it can be deadly. The mortality could be significant. One of the major causes or etiology of this mortality is acute severe dehydration. So it's not even the cholera infection that kills many people, but the dehydration, because they lose a lot of water. The primary symptom of cholera is something called rice water stool. In rice water stool, the person just keeps pouring out water, like defecating loose stool, watery stool, severe, and there's also associated vomiting. The person is vomiting also. So because of this cause or this pathophysiologic or pathogenetic effect, the person develops loss of what? Of electrolytes, especially sodium, potassium, and even magnesium. So the person becomes severely dehydrated. In children, it is even worse. You see them, they look malnourished, and they have what we call loss of skin turgor. So if you see an infant who is suffering from cholera, when you prick the skin up, it takes a long time to go back to normal. So we call that lack or loss of skin turgor. So these are part of the symptoms and signs you find in a patient that has cholera. Associated weight loss, there could be fever, and there could be all other symptoms with it, which we'll talk about, in addition to how we can prevent it and treat this condition.
Thank you so much. You've mentioned a whole lot of things now. You talked about signs and symptoms. But are there similarities between cholera, diarrhea, and dysentery?
Yes. You see, in cholera, you have diarrhea. I'll give you an example. It's like in malaria, you have fever. But people call it malaria fever. They call some typhoid fever. They call it now Lassa fever. Even this Ebola fever. You can call also this COVID-19 also. There's fever. So fever is a sign or symptom which manifests in this. So diarrhea is also one of the signs or symptoms that you can see manifesting in somebody that has cholera. So somebody that has cholera, the person has diarrhea, and the diarrhea is pathognomonic of a rice water stool, that is watery diarrhea. So the person is having severe watery diarrhea, and if you see it, it's like rice water. So that is one of it. Now you talk, there's another one called dysentery. Dysentery is also associated diarrhea with bleeding, with blood. So in that person, when you see somebody having diarrhea with blood, that's dysentery. When you just see somebody having rice water stool, the person, you just see someone with, if you have seen someone with cholera, you see the kind of stool the person passes out is so watery, it's like rice water. That's why it is called rice water. So it's like when you cook rice, the way the water is, the person is just pouring out losing lots of water, lots of electrolytes, and this is what causes the death in that person. If the person is not properly rehydrated and resuscitated, the person might also go into shock, and the kind of shock is called hypovolemic shock. That's because they have lost a lot of fluid, and after that it is death. If it is not arrested, or if the case is not resuscitated or managed effectively or on time.
So what's the first aid response you give to someone who you feel might be coming down with cholera? Because you mentioned, you said 2 hours. All right, so you have a colleague, you have a friend, you're at home, the children are at home, this halls, and you just see this sign that the child has been vomiting. You don't have a quick response to it. You can't get to the hospital immediately. What are you supposed to be doing at that time to at least save the person, or at least put the person in check before you get to the hospital?
This is a very important question. The first thing you do with someone with cholera is to rehydration. And the rehydration process is a common one which we have been taught since our childhood.
Okay.
It's a home management process where many people have learned, either consciously or unconsciously.
Okay.
And this is known as the ORS.
Okay.
Oral rehydration solution. Now, there are sachets of ORS which you can just buy, but as you said, what if it is in the middle of the night, you just notice the person is vomiting and having diarrhea, and you call a cab, and before you can get a hold of that, it's going to a long time, the person is losing lots of fluid, the person is going into severe dehydration. So hopefully you have sugar in your kitchen, you have salt. So the method I will just teach everybody now, so they understand how to administer somebody with cholera. So you take your teaspoon and you scoop 6 level spoon of sugar inside 1 liter of water. And you then take half level spoon of salt inside the water. You stir and you make it dissolve completely. After that, you give the person about 50 mils, on 50 to 100 mils every time this person loses stool. So you are trying to replace the lost fluid. So this is something you can do at home, pending when you take the person to the hospital, where the person will be treated and given antibiotics to treat the cholera infection. The person could also be given analgesics or antipyretics to also reduce the fever. Cholera has a duration. So it's most of the time after the duration and after the treatment with antibiotics and antipyretics, they usually come normal. But what we can do as individuals, we should know how to make use of ORS, oral rehydration solution, especially for kids. Once you see your child is losing stool frequently and it is watery and the child is vomiting, please use the ORS. Now many people also can buy this ORS in your pharmacy, you can buy it in hospital, you can buy it in places which are safe and use them. So this is a way in which we can, this is the first one. The second one also, if the person is having fever, you can tepid sponge. Tepid sponge means that once you touch the person's skin and you feel the person is hot, also you can get a homemade thermometer, this electronic one. If the temperature is way above 38 degrees centigrade, even 37 to 38, if it's above that, then the person is having fever. So you take a towel in water, squeeze it, and just tap it, sponge the person. If the person is an adult, the person can have a cold bath just to reduce the temperature. If you have paracetamol at home, it is OTC, over the counter. The person can take paracetamol. The person can take oral rehydration solution. Then you take the person to hospital where the person will be treated. Blood samples will be taken, stool samples will also be taken to confirm that it is cholera, and the person will be treated accordingly based on antibiotics. The person can be given intravenous fluids, intramuscular injections, and also other medications
just to resuscitate the person
and resuscitate and treat the infection.
So that's why people love this program, because this is just free consultation on TV. I remember I heard about ORS when I was a child, but of course you need to keep, keep repeating that emphasis on the fact that you need to know these basic life skills.
Know how to administer the ORS
in terms of measurement.
Yes.
And that's because you don't hear it all the time.
So normally the sachet is usually prepared and you are told already put it in 1 liter of water. So we have bottled waters that are already 1 liter. In
terms of the measurements, the bottle.
Just put the ORS inside, mix it well to
you
dissolve.
Shake.
Once it is dissolved, give the person gradually. Do not force them to drink. Yes, they will vomit, don't worry. Because you are still rehydrating them. Don't worry, they are vomiting, but keep rehydrating, because if you stop rehydration, the person can go into coma and shock.
Wow.
And in later time, the person might die. So that rehydration you are doing, that ORS, as it looks simple, it is life-saving.
Okay.
It's very life-saving. And prevention is always better than cure.
Cheaper than cure.
So in prevention, make sure you are maintaining good hygiene. Always wash your hands with soap and water for at least 20 seconds.
We'll come to that. Let's take a short break when we return, all right? We'll go on a short break now. When we return, Health Watch continues. Stay with us. Okay, welcome back. If you're just joining us, the program is still Health Watch, reaching you from the station of excellence, NTA Lagos Channel 10. And our guest is still here with us, Dr. Love, in the person of Dr. Ademola Yusuf Harun. Okay, we're talking about cholera. Before we went on the break, you've said a whole lot about ORS, and which I also mentioned, I've heard that before, all right? But it's good that we continue to lay emphasis on some basic life skills that everyone should know, all right? So talking about policies, advocacy, I know that you do a lot of partnership with the government, with the Lagos State government. So what is being done right now, and how is it being implemented?
Now we have 57 LCDs, or local governments, local council development areas in Lagos State. Each of these local council development areas or local governments have multiple primary health care. For example, if you look at Ifako Ijaye local government, they have 7 wards. If you look at the Bariga LCDA, they have 8 wards. We have Ikeja also, where they even have a teaching hospital. They have many primary health care centers. Each of these wards have primary health care centers, or supposedly. Now, in these wards, that is where the health advocacy comes. So what the government is doing in Lagos State is that they are bringing about primary health care awareness. Education is number 1 in cholera. You have to enlighten people, public health enlightenment, and they do it on TVs as we are talking now. They do it in the papers, they post it in their walls, in their hospitals, in the health centers, and everywhere to enlighten people about it. There was a time when I was a kid, we saw community health extension workers put on a kind of government or healthcare costume, and they go administering vaccines or immunizations to people. There's an immunization for cholera too, which people are babies are given at age, I believe, 6.
How effective is that?
Now, the problem is that this cholera undergoes what we call mutation. It changes. So you might even give it a vaccine and it changes to another one, so you are now looking for another vaccine. But prevention is very important. Education. Wash your hands well with soap and water for at least 20 seconds. That can save you many diseases. Even this COVID, even this Ebola, even this cholera. Many things. Even the risk of contacting hepatitis and other things. Secondly is that do not eat just in any public place you don't know the source. I've seen a situation where people went to a party to eat and everybody in that party developed gastrointestinal infection conditions. Query cholera. They started passing watery stool. Food in that party was contaminated and all of them got infected with cholera and they started passing watery stools. So you can imagine how risky food is. I'm not discouraging people from eating in parties, but let us be careful what we eat. Remember this common saying, you are what you eat. Absolutely. So let us be careful what we put into our mouth. It can make us or it can break us. So it's very, very important. Hygiene is also important. Now, one of the things the government have done or can do better, as you asked about Lagos State, is to maintain proper environmental sanitation. When we were kids again, we had this regular sanitation.
Every Saturdays.
Saturdays, mandatory, you don't go out. Now the rules are laxed. We are not seeing that kind of thing. That thing maintained hygiene. You clean your gutters, you clean the environment, you sweep the floors. This will reduce infections, not only cholera, all other infections. Also, another thing the government can do is to build health toilets, public latrines in designated areas, so that people, when they are pressed, they don't just start doing their business on the streets.
To prevent open defecation.
Open defecation, then rain falls, the water from the rain goes into where someone is washing a plate and cooking, and she also uses that water. If you even see where some people cook food again. So another regulation which the government is doing, and they can do better, is to regulate public food or public restaurants.
Food vendors.
Food vendors. All these people carrying food everywhere. We don't know the kind of water they use to cook that food. There was one that was shown that went viral online where one man who was selling fruits, just used gutter water to be washing the fruits, and people eat it. So this kind of people can develop cholera. Also, some women who are cooking food, they just use dirty water to wash the spoon and the plate and make it dry. So even when they boil their food very well, but that plate is infected. So they serve the food on that plate with the spoon. Person eats rice or beans or stew with it, and the person is infected. What about those who are selling things like puff, akara, bean cake, and things like that?
Boiled corn, roasted corn.
They do everywhere. They just get a paper. Imagine someone has used part of that paper to clean his or her private part, and they don't know. They just see some papers on the floor, and they use that same paper to sell roasted corn. Person can develop cholera. So these are part of the ways in which people develop infection, and the government has to regulate health sanitation, health policies to prevent the spread of infections like this.
Fantastic. You said a whole lot too. We'll move from what the government is doing to implementation and of course to preventive measures. Now very quickly, in like 2 minutes, what's your message to Lagosians? Because we are always on the move. We want to snack on something, we want to get the fries, we want to get the boiled corn. So how do we manage the situation, Lagosians and Nigeria at large?
Your health is your wealth, and I would advise everyone to maintain good health. Make sure you wash your hands regularly before you put it in your mouth or you put food in your mouth. Also make sure that when you are defecating or urinating, do it in closed places, especially men. You don't just stop at anywhere to pass urine or to defecate. Try to do it in closed places and places where there are water to flush it or to clean it away, so it's not just exposed. I also advise you all to maintain good hygiene, and if you or anyone has symptoms of cholera, which is associated with vomiting, watery diarrhea, which is called rice water stool, fever, weight loss, headache, body pains, please consult your doctor urgently for better treatment, because the dehydration in cholera is actually what kills other than the disease itself. Thank you.
Thank you so much. A wonderful one from you, Dr. Love. Thank you so much for coming on the
Always
program.
Anytime.
All right, moving on, we have a short report on the importance of fruits. And you've heard it all from Dr. Love. If you need to get the fruits, you need to wash them properly, all right, under running water. But let's go on this report. We'll be right back. Stay with us.
They are nature's free gift to earth. So colorful, sweet, highly nutritious, and come in beautiful shapes, sizes, and flavors. Fruits such as oranges, bananas, watermelons, strawberries, pineapples, mangoes, avocados, apples, and a whole lot of luscious wonder are nutrients powerhouse because they are packed with essential vitamins, minerals, fiber, and antioxidants that help your body grow, heal, and stay healthy. They also help in anti-aging, promote healthy skin, and aid weight management. Whether you add it to your breakfast, snack on it during the day, or blend them into a smoothie, or you could also infuse them to your water for natural flavor. It is advisable to incorporate fruits in your daily routine.
that's much you can take on this week's edition of Health Watch. Remember, I normally say that health conscious people live longer. You feel anything, you see any sign, make sure you see your doctor. And don't forget ORS. You need to learn that life basic skill. All right, you have questions, you have inquiries, you love to see my face every week, send a message to 07060865487 or send a mail to okibinkem@gmail.com. Thank you for being part of this week's edition of Health Watch. My name is Nkem Okibe. See you next week, same time, same station. Bye.
You want the best